Hi, I'm Dr. Amjad, and now we're going to talk about diabetic eye diseases. Before talking about a diabetic eye disease, let us recap how a normal eye works. For a normal eye to see an object, light has to travel through the transparent cornea, the pupil, the transparent lens. This light ray then passes through the vitreous gel. Now, what's a vitreous gel? Now, vitreous gel is a transparent gel which fills the middle of the eye. The light traverses through this transparent vitreous gel, falls on the retina. The retina is a light-sensitive tissue lying at the back of the eye, and the macula is a very small area right at the center of the retina that gives us fine central pinpoint vision. Diabetes mellitus is a condition, in simple, which raises the sugar level in your blood. If your blood sugar is high, now this blood with high amount of glucose in it is roaming in your entire body. The big blood vessels in your hands, in your legs, in your visceral part of the body, they can sustain. They're like huge big pipes through which water is flowing, and they can sustain this. But when it comes to the retina of the eye and the blood vessels on the retina, they are very fine. They're as fine as your hair and maybe finer than that. The capillaries there, capillaries is the thinnest portion of your blood vessels. The capillaries in the retina, which are intermingled, they cannot sustain this pressure of the blood with the high glucose. Now, what happens in a diabetic retinopathy? Diabetic retinopathy is a condition that occurs in people who have diabetes. It causes progressive damage to the retina. Types of diabetic retinopathy. Basically, it needs to be classified into two types. A non-proliferative diabetic retinopathy, NPDR, which is the early stage of the disease with mild or no symptoms, and PDR, which is the proliferative diabetic retinopathy, which is the more advanced stage of the disease. Now, what is NPDR? Just as I said, it's the early stage of the disease, mild or no symptoms. The blood vessels in the retina are weakened. The tiny bulges which you see in the blood vessels, they are known as microaneurysms. They may or may not leak, and the macula most of the time appears normal. Now, I talk about proliferative diabetes. It's a more advanced form of this disease. At this stage, blood circulation problems deprive the retina of oxygen. As a result, what happens? Because of less of oxygen, new blood vessels begin to grow in the retina and into the vitreous. But the problem is this: these new vessels are highly fragile. They are not something which can sustain. They break, resulting in leakage of blood. Other complications of proliferative diabetic retinopathy include detachment of the retina. Why? Because the new vessels which are formed are actually fibrovascular tissue. Along with the vessels, there is a fibrous tissue which, when contracts, it pulls the retina out and causing retinal detachment. Now, how is diabetic retinopathy diagnosed? Diabetic retinopathy can be diagnosed through comprehensive eye examination, a good clinical evaluation of the retina and the macula. This may include a good history taking and direct ophthalmoscopic examination, fundus photography, sometimes fundus fluorescence angiography, and at times, if it is involving the macula, and which in my case I would prefer for all patients, getting an OCT done to document the state of the macula. Very early stages, there may be no changes on the OCT, but still it is advisable to get your OCT done right in the beginning. To have a baseline level, it's very easy for us to pick it up. Now, what can be the treatment plan for diabetic retinopathy? Early stages, observe, observe, observe. At a later stage, you may need treatments into three varieties. Most of the times it is only PRP, that is laser photocoagulation therapy. It may be intravitreal injections inside the eye, and worst case scenarios may lead up with a surgery called as vitrectomy. And let us talk about all these three conditions in detail. First, we are talking about PRP, or the laser photocoagulation. Now, what's PRP? PRP is basically laser photocoagulation therapy which prevents vision loss in patients with diabetic retinopathy. The lasers are fired in two different patterns. One is a scatter laser treatment, one is a focal laser treatment. What happens in a scatter laser treatment? A scatter laser treatment helps to shrink abnormal blood vessels and is most effective before damaged vessels begin to leak and bleed. The treatment involves placing 1000 to 2000 laser burns away from the macula, causing the abnormal blood vessels to shrink. This procedure can sometimes produce some loss of peripheral vision, night vision, and color vision, but it is still very effective in preserving remaining eyesight. What is a focal laser treatment? It's a photocoagulation laser which is used to treat the macular edema. Instead of 1000 or more laser burns, focal laser surgery involves a few hundred burns around the macula to stop the blood vessels from leaking. With both the scatter and the focal laser treatments are delivered several weeks apart if both the eyes are involved. The next line of treatment is intravitreal injections. When does the role of intravitreal injection come into play? It's only when the macula is involved. That's when the macula is edematous. Accumulation of fluid in and around the macula is known as macular edema, and all macular edemas should ideally be treated with intravitreal injections. What kind of injections? For macular edema, the ideal injection is an intravitreal steroid. And there's another intravitreal injection we're talking about. We're talking about anti-VEGF. These injections may be used with or without macular edema. Also, antivascular endothelial growth factor, anti-VEGF drugs have been developed for the purpose of preventing new blood vessel formation. Elevated VEGF has been implicated in the development of diabetic retinopathy at all stages of the disease, though it is found in the highest levels in proliferative diabetic retinopathy and macular edema. And the last resort in the treatment of diabetic retinopathy remains vitrectomy. If the bleeding is severe, vitrectomy may be performed to remove the blood from the center of the eye. During the procedure, the vitreous gel that has been contaminated with blood is removed. A salt solution replaces the lost volume. PRP is done along with the vitrectomy, which is known as endolaser PRP, to treat any proliferative condition. The downside of vitrectomy is it can accelerate development of cataracts. Thank you for your attention.